Okay, good morning. I think we'll make a start because I know you've all got to be in different places for 9:30, although I hope those of you in the audience are going to stay with us. I'm Sue Farrington, President of FESCA, and on behalf of FESCA, it's a real pleasure to welcome you all to the 2026 World Scleroderma Patient Conference. I've looked at the list of attendees and it's absolutely amazing to see that we have so many people registered from countries across Europe and from the rest of the world. So I think this is testament to the work of Professor Marco Matucci, who's going to be speaking to you later, who started this amazing conference back not 9 years ago, but 16 years ago. And so we have the World Scleroderma Foundation to thank for helping us make this a possibility. Joining me on the stage are our guest speakers, patient advocate Kati Atonopoulou and Mrs. Cristina Maria Caveri and Professor Marco Matucci. But before we begin, just a few housekeeping rules. This is a plenary session and it's being translated and recorded. Please keep your phones on silent. And if you do need any assistance, our volunteers will help you. And I'm just wondering whether our volunteers are visible so that when you do need help, you know who to go to. So if you could just kind of wave your hand and make yourself visible. And if not now, maybe later when we've finished this session. So over the next 2 days, we're going to be exploring a wide range of topics, and they vary from accelerating access to therapies, improving early diagnosis, understanding new technologies like CAR-T, and also breaking the silence around those topics that sometimes people feel uncomfortable to talk about. But this is really the space and the place for that to happen. This year's programme reflects a powerful truth. Patient needs, patient experiences and voices must be at the centre of everything we do. And it was a pleasure last night to speak at the opening of the Clinical Congress, and for the first time to be the patient advocate amongst a scientist and a clinician to speak about the value of our partnership across the community, because it's only when we work together, all stakeholders, that we're really going to truly make the difference. So throughout this conference, you're going to hear stories, courageous, honest, sometimes painful, but always inspiring. Patient stories aren't just anecdotes. They are the data, I would say, with a human heartbeat. They illuminate what clinical trials cannot measure: resilience, fear, hope, and the quiet strength that defines our community. When we share our experiences, something remarkable happens, as we heard in our members' meeting yesterday, and it hadn't quite really resonated with me, so thank you to our members from Croatia and Macedonia for saying this. When we share our experiences, we break isolation, we build understanding, and we create change. Patient organisations across Europe and across the world, including those represented here today, provide a lifeline through support groups, information services, helplines, and advocacy efforts. Your work is extraordinary, and your impact is profound. So a massive thank you to everybody. I would now like to invite Mrs. Cristina Maria Caveri, Secretary General for Public Health in Greece, to speak about the support that's available in Greece for people living with rare diseases, such as systemic sclerosis. We're honoured by your presence and grateful for the growing recognition of rare disease needs at national and European levels. Thank you.
Good morning, everyone. Distinguished representatives of FESCA, dear representatives of Hellenic League Against Rheumatism, esteemed scientists, researchers, and representatives of patient associations from more than 50 countries. Ladies and gentlemen, it is a great honor for Greece to host in Athens the 9th Systemic Sclerosis World Congress, the most important international event dedicated to one of the most complex and demanding rare diseases. Your presence here reminds us that rare diseases, although individually uncommon, collectively represent a major global public health challenge. At the same time, they are a field of scientific innovation and, equally important, a matter of social justice. Today, I would like to focus on 5 interrelated pillars that shape modern policy for rare diseases: early diagnosis, equitable access to treatment, multidisciplinary care, structured national planning, and the strategic European dimension of health policy. Systemic sclerosis is a multi-system autoimmune disease. It is characterized by heterogeneity, complexity, and often delayed detection and diagnosis. Delayed diagnosis is not merely a clinical issue. It is also an indicator of how effectively a health system functions. Accelerating diagnosis requires a well-trained healthcare professionals, clear referral pathways, and access to specialized centers of expertise. In Greece, we are systematically working to strengthen these mechanisms, recognizing that each month of a diagnostic delay may have long-term consequences for the course of the disease. For public health systems, rare diseases also highlight the importance of early detection, integrated care pathways, and coordinated services, areas where science and policy must work closely together. The way a health system addresses rare diseases is a strong indicator of its credibility. It is a field where scientific complexity meets social responsibility and where innovation continuously tests the limits of our public financing. In response to these challenges, the strategic choice of the Ministry of Health in Greece is clear: to move from fragmented management towards a coherent public policy framework based on data, institutions, and, of course, transparency. A central element of this approach is the development of national patient registries for rare diseases. For the first time, the country is establishing structured digital patient registries integrating within the electronic prescribing environment. Registries are already operating for specific categories of rare conditions, while additional registries are being developed to cover broader medical fields, including rheumatological diseases. These registries are not merely administrative tools. They are essential instruments of public policy. They allow confirmation of diagnosis through unified criteria, monitoring of disease progression, assessment of treatment effectiveness, and evidence-based allocation of resources. In the same direction, the adoption of a unified catalogue of rare diseases based on orphan codes, aligned with international coding systems, strengthens transparency and interoperability. Accurate registration is a prerequisite for sound health policy. Equally important is the development of centers of expertise for rare and complex diseases, which concentrate specialized knowledge, promote multidisciplinary collaboration, and are connected to the European reference networks. Access to care does not end with the approval or reimbursement of a medicine. It includes comprehensive, continuous, and patient-centered support, physiotherapy, occupational therapy, psychological care, and social protection. At the same time, mechanisms for the evaluation of high-cost medicines are being strengthened based on scientific and economic criteria, ensuring a balance between patient access to innovation and the sustainability of public health systems. Health technology assessment plays a crucial role in this process, providing a structural framework for a decision-making grounded in clinical effectiveness, social value, and responsible resource allocation. The strengthening of the European Health Union and the new European framework for joint health technology assessment are shaping a new reality for rare diseases. Greater convergence in evaluation procedures and deeper scientific cooperation among member states can significantly reduce inequalities in access and accelerate the availability of innovative therapies, including orphan medicines. For rare diseases, this European cooperation is the foundation for fairness and solidarity. The next decisive step for our country is the completion of a coherent national action plan for rare diseases. This plan aims to bring together prevention, diagnosis, treatment, and patient support within a unified strategic framework. It will include the training of healthcare professionals, the strengthening of genetic testing services, improved access to clinical trials, and the institutional participation of patient organizations in the design of public policies. Rare diseases require long-term political commitment. They cannot be addressed through fragmenting initiatives. They require coordinated, holistic governance. Dear ladies and gentlemen, rare diseases reminds us that the true value of a health system is measured not only by how many people it serves, but also by how it stands beside those who feel most vulnerable. People living with systemic sclerosis know what resilience means. They live with a body that is constantly tested, yet with a spirit that persists. May this Congress become more than a scientific milestone. May it also be a collective affirmation that progress is meaningful only when no one is left behind, even where their condition is rare. Ultimately, rare diseases remind us that medicine is science, policy is responsibility, but care is above all an act of humanity. Thank you very much.
Thank you so much for sharing those plans. It sounds really far-thinking, foresighted, and particularly the focus on patient registries, which, as we know, for rare diseases are critical because there aren't sufficient size of population when it comes to clinical trials. And so pulling that information into one place, I think, is really key. The other thing that you mentioned were the European reference networks. And this is a way that we can really have care beyond borders, because not everywhere can have access to a specialist centre. So thank you very much for sharing this vision and obviously the work that you've already started in Greece. Thank you so much. Our next speaker, Cassie, is president of the Hellenic League Against Rheumatism and president of Sjogren Europe. She's a health communications expert and a European patient advocate, active in policy and research at many levels. And there's probably too many to list, so I'm going to hand over to Kati. Thank you.
Oh, you cannot see me. Yes. Okay, I will be right here. Can you see me right now? Okay, thank you. So, dear friends, dear colleagues, dear members of our global community, it's a true honor to welcome you to Athens, a city historically associated with dialogue and collective responsibility is a firm place for that gathering, because systematic sclerosis demands exactly that: dialogue, collaboration, and shared action. I'm here as the president of the Hellenic League Against Rheumatism and as a European advocate working across Sjogren Europe, EPF, European Patients Forum, and Agora Federation and EULAR PARE Committee. Across these roles, one lesson is clear. When patients are meaningfully involved, healthcare systems became stronger. Systemic sclerosis is rare and complex, but the challenges patients face are clear, very, very clear. Diagnosis is often delayed. Care is frequently fragmented. Access to specialized centers and innovative treatments remains unequal. And beyond this clinical dimension, there is a dire burden: fatigue, pain, uncertainty, changes in physical appearance impact the work and the relationships. These realities shape lives in ways that statistics cannot fully capture, and this is true. So what needs to change? What we have to change? What we really need to change? We need earlier recognition and referral pathways. We need structured, funded multidisciplinary care. We need equitable access to therapies across countries. And we need patients' involvement embedded in research, regulation, and policy, not as a symbolic point or participation, but as equal partnerships. We need to be, and we have to be, equal partners. For rare diseases like systemic sclerosis, progress cannot depend on geography. Cross-border cooperation is not optional, it is essential. This is why congresses like this matter. They are not just meetings. We are not just another meeting. They are catalysts here. Here lived experience meet expertise. Here is isolation turns into connection. Here unmet needs became shared priorities and collective strategies. There is also a responsibility we carry as a community breaking stigma. We need to break stigma. Systemic sclerosis can be visible and misunderstood, or invisible and underestimated. Both can silence patients. When patients share their stories, they transform vulnerability into knowledge. When they organize, they create influence. When they participate in research and policy, they redefine expertise. And patients' organizations are not support structures alone. They are drivers of change. They ensure that lived experience informs science, that needs inform policy, and that no one navigates this journey alone. We cannot do anything alone. The future of systematic sclerosis care will not be shaped by science alone. It will be shaped by partnership, structure, accountable, and encourages partnerships. Let this Congress in Athens mark not just another meeting, but a turning point in how systemic sclerosis care is shaped together. Thank you very much for your participation and commitment, and welcome you to Athens.
Thank you very much, Cathy. And I also want to say a massive thank you to you for all the work that you do at a policy level across Europe. Because as condition areas on our own, we're not going to make the changes that we need to see in the healthcare system. We need to come together with other rare conditions, with other rare rheumatic conditions. So thank you for all the work that you're doing. Next up is a man who probably needs not much introduction to many of you, Professor Marco Matucci, the president of the World Scleroderma Foundation and professor of rheumatology at the University of San Raffaele in Milan. Marco has long championed the importance of bringing patients and clinicians together, so it's a pleasure to ask him to say a few words.
Thank you, Sue, for calling me here to be with you today, and I'm very happy. I'm very happy because our strong determination from, I may say, from more than 20 years, because in 2005, FESCA was funded, and they started in Vienna. in Vienna at the EULAR Congress. In those times, we were really convinced that patient needed a fully independent area where they could develop and they could really expand their mission. Because if we have a mission, also you have a mission. Our mission is to help you and to do anything we can to support you and to try desperately to cure you. Sometimes we make it, sometimes we don't make it. And it's not easy, also for us. It's not easy because many times we are defeated. We would like to do much better. And that's the reason why we are here today. So the fact that you have your Congress, we have our Congress, this does not mean that we are divided. We are all together. But you need your independence, and we listen to you. This is very important. So the fact that we can listen to you is dramatically important, because we learn. The moment a patient is making a comment, it's a treasure, because he's guiding us. He's telling us the truth, because patients always tell the truth. Sometimes the truth is difficult to accept, but at the end of the day, it's very important to be able to listen. So, for this reason, I'm very happy to be here with you today, and we shall be in Florence next time. And I hope you will come also in Florence in 28, because we started actually in Florence 2010. So the steering committee decided to go back to Florence, and you may have noticed, Sue and also the patient, that we are increasing the Congress, because before it was, for us doctors, was 2 days, now it is 2 days and a half. So practically we may say we are growing. There is a huge interest now about scleroderma. It's growing and growing, because scleroderma is characterized by fibrosis, and this problem is now getting the attention of the pharma companies. So we have really now a new renaissance for what concerns scleroderma, a new interest, and new also energies that are put in trying to understand as much as we can the mechanism that provoked the disease. So looking now back in the last 2 decades, we can say we have done a lot. We have done a lot. I have been almost present always at your Congress, just looking and listening and trying to foster as much as possible your growth and participation. And I'm very indebted with Sue Farrington for helping us and also getting us all the critical point that we should ameliorate. So at this point, I would like to greet you and to tell you thank you for being here. Thank you for being here, because also for us it is very important. Thank you, Sue. Thank you to you all patients. Thank you very much.
Big thanks to all of our speakers for setting off this conference in style, sharing your vision and hope for the future. But my thanks also go to Ilaria Galetti and the working group who have produced this extraordinary programme, to Cathy and Amalia for their support with the operations on the ground here in Athens, to Maria, Rebecca and Anastasia, our secretariat team from Patvocates, who've worked tirelessly behind the scenes to make this happen. And my thanks to you, to everyone here today. Thank you for choosing to be part of this journey. This Congress exists because of you, your stories, your needs, and your questions, and most importantly, your determination. Together, we can continue to drive research, to shape policy, improve care, and most importantly, support one another. It's now my honour to officially open the 2026 World Scleroderma Patient Conference. Thank you and welcome. We will just take a few minutes and then I will come back and introduce the next session. But I know that our speakers have got things to get onto, so we'll be back.